Welcome and hello. I'm Ann Peters from the Pulitzer Center, and thank you for joining us today for Health Systems in Collapse, Understanding an HIV Outbreak in Pakistan with Dr. Helen Ouyang. As we wait for more people to join us, please let us know in the chat where you're listening in from. For those of you who have not been with us before, the Pulitzer Center is a nonprofit journalism and education organization with the mission to elevate public engagement with underreported issues. We have been working across the world, even though we are based in Washington, D.C. We support more than 170 reporting projects each year in collaboration with news outlets and bring together this work by themes on our website, including racial justice, migration, public health, and more. And we don't stop with the reporting. Our education programming spans from elementary schools to graduate degree programs and our outreach to the broader public. A few logistics as we begin. Our aim is to incorporate audience questions as part of today's conversation. So you'll see a Q&A icon on your screen. Please begin adding your questions as soon as something comes to mind during our conversation today. There is also a chat icon on your screen. We'd appreciate it if you use that chat box only for specific technology questions, if you can't hear us, for example, although please note that all attendees are muted for our webinar today. We want to let you know also that we are recording this session to post online at a later date. And one final note, please remember to stay online once our conversation ends today to participate in a brief survey. Our aim is to continue improving our programming. Now I'd like to briefly introduce our guest. Dr. Helen Ouyang is a board-certified emergency medicine physician and an assistant professor of emergency medicine at Columbia University Medical Center. She is a graduate of Johns Hopkins School of Medicine and completed her residency at the Harvard-affiliated Brigham and Women's and Massachusetts General Hospital program. She also holds a master's degree in public health from Harvard. Helen notes that she's keen on promoting wellness with her patients in the emergency room, as well as when she is working in conflict and disaster settings. She also finds the time to report and write about wellness, global health, and complex humanitarian emergencies. She has contributed to The New Yorker, The Lancet, among other publications, and she is a contributing writer at the New York Times Magazine. Her Pulitzer Center-supported project is HIV Outbreak in Pakistan, and her story, The City Losing Its Children to HIV, has been published in the New York Times Magazine. Helen, thank you for joining us today.
Thank you for having me.
Your reporting examines this devastating HIV outbreak, in part, as you were explaining in your article, resulting from the government's neglect of a healthcare system. 2 years ago, you were talking about the outbreak in Ratodero, Pakistan, and a doctor diagnosing a 16-month-old girl with HIV, yet neither her parents were HIV positive. Can you go through how you came to that story?
Sure. So this story had been reported locally. It's actually how the government found out about the outbreak was the local media actually broke the story, and then it became national there, and then eventually it became international. So I had heard about it through local and international news reports about the story. And as you mentioned, Anne, the parents of this child didn't have HIV, which made it extremely unusual.
And tell us more about the doctor and his diagnosis, and then what he found after seeing this child for the first time.
Right. So Dr. Arbani is a local doctor in Ratodero. He's actually a urologist. So Nazir Shah, who is the father of the first child diagnosed from the outbreak, actually lives nearby Dr. Arbani, but he was hesitant to bring his child there initially because he has a child, and Dr. Arbani is a urologist, mostly sees adults. But he had gone to many hospitals, many clinics, both in Ratodero and a little bit larger town called Larkana. So desperate, he finally just went to his clinic, which is basically his neighbors, and brought his child in. Iman, and the child was very sick. She was 15 months old. She weighed about 11 pounds. You know, she was drooling. She had thrush in her throat. So Dr. Arbani said, the one test that hasn't been done is an HIV test. And initially, the father was quite hesitant about doing it because didn't have any risk factors. The mother wasn't HIV positive. Usually HIV is transmitted vertically, meaning during labor or childbirth, during breastfeeding. So none of those was the case here. And the father also didn't have any symptoms. So finally, he agreed to do the test and it ended up being positive. Dr. Arbani knew that this was incredibly unusual. So he started to be pretty vigilant in looking out for cases. So whenever a child did come into his clinic and had symptoms of some immunocompromise, or just had been sick for a long time and wasn't getting better, or was underweight, had diarrhea, cough, he would send them for HIV testing.
And at the end of this period of time, I think you were reporting that he found 20 more cases in this span and then uncovered this outbreak.
Yeah. So I think by the time the news reporter reached out to him, he had about 14 cases. And even the news reporter reaching out to him was kind of serendipitous because his cousin's child died of HIV. The reporter was actually in Karachi, so quite far away from Ratodero, 6-hour drive. But he had a cousin who lived in Ratodero and his child died of HIV. So he had heard of Dr. Arbani just, because he's one of the local doctors, and through a friend of a friend, he called him and said, this is extremely strange because the child's parents didn't have HIV and we don't know anyone with HIV. How do you think this happened? And Dr. Arbani was like, oh, actually, I have 14 more cases, and handed them over to the reporter. And that's how the story became public. And there was another reporter at the same time who saw a Facebook post from the father of Aman Shah, who posted on Facebook about this case. So both reporters broke the story on the same day.
Yeah. So at that point, this was a medical mystery. How do these children under 10, even younger, who don't have the transmission situation that you were talking about, how did they acquire HIV? What did your reporting and their reporting unearth at that time?
Right. So when the government found out about this and the international community found out about this through the news reports, they sent a team down to investigate. And they did get the team down pretty quickly. Within a week or two, the World Health Organization, the CDC, and some other folks came and investigated. And they saw initially that a lot of the kids had visited a local pediatrician who was reusing needles, reusing syringes and IVs. But then they also saw that it was a larger practice throughout the town. And then if you talk to anybody who is from Ratodero, even from Pakistan, they'll tell you it's a pretty widespread practice and almost all throughout Pakistan, except in Islamabad.
Yeah. And is it in part the situation, the expense of having the medical equipment, the conditions? What had led to that in your reporting and in the view of the agencies that reviewed the information that had led to that situation?
So it's a pretty complex set of factors. Definitely poverty and poor medical conditions leads to reusing needles. A lot of times the parents, so in Pakistan, usually you have to go to the pharmacy and get your own needle and IV set. The hospital doesn't provide it. But in a lot of these places, the parents can't afford it. So the doctors, I think, and mostly goodwill, will have some on hand, but because they're also not wealthy, they also can't afford to just supply all the patients with the medical equipment. They end up reusing some of it, unfortunately. But deeper than that, I think there's a cultural phenomenon in Pakistan where there's a belief that if you don't get an injection, you're not really being treated. A lot of studies have shown that Pakistan actually has the highest number of injections in the world. And even when the team went down and investigated these children and how they got infected, they saw that they actually had received more injections than the children who were HIV negative. So that's a big reason. The other problem is the public clinics and hospitals, they're free, but they usually close at 2 p.m. And a lot of these doctors go and work in their private clinics, and they're, vying for patients. So they want to give patients what they're asking for, and they want to make them feel heard and treated. And oftentimes that's through an injection.
Mm-hmm. And in part, your reporting also talked about overall, as far as the trend on HIV overall in Pakistan, in terms of it trending, increasing, so going in the wrong direction as opposed to decreasing. Can you speak to some of that in terms of the background, just in terms of the situation in Pakistan overall regarding, one of those three big infectious diseases where you have HIV, tuberculosis, and malaria?
Yeah, in Pakistan, the HIV numbers are definitely been going in the wrong direction for a while. A lot of it is they're not being tested, whether people don't want to be tested or they don't have testing services, or both. So at one point, I think less than 15% of people even knew they were HIV positive. And that's the same number that it's actually on treatment. So it's being spread, whereas in sub-Saharan Africa, a lot of the community and the international organizations have really worked hard at getting the numbers down. Pakistan has really gone in the opposite direction, sadly. So that's, the current state that was going on. And then tuberculosis is linked with HIV. People who have HIV, especially at more advanced stages when it's not being treated and their immune systems are suppressed, are at much higher risk for tuberculosis. So that's a big number too. And then even hepatitis C, which is a virus that's transmitted through, again, injections, that's up in Pakistan as well. So they're all linked together.
You were talking about the difference between the public health, private health situation. I know in your reporting, you also talked more about these clinics in markets, places. So can you set the scene if someone's child is ill? We're talking about the various places that Mr. Shaw had gone to when his daughter became ill. Walk us through a little bit more of that journey that he was trying to undertake, or he was undertaking, in terms of finding a way to have his child become healthy again.
Right. So the public health system, the public hospitals, I should say, the public clinics, it's the belief of the local people that they don't get treated very well there. Most of the people aren't educated, and they feel like when they walk in, the doctors don't respect them and don't treat them very well, and the places aren't very well kept, they're dirty. So most people seek private care. So there's these big markets where they're selling food and household items, and they're all outdoor markets, and it's very dusty roads, it's very hot, there's animals around and children running everywhere. And basically, every couple of storefronts, there's a little pop-up clinic. And that could be run by anybody. It can be run by somebody who's gone to school for a year and just operating under another doctor, operating under a doctor's name, and that doctor is never on site. And this person basically acts like a doctor. It could be a pharmacist. It could be someone who's doing more holistic medicines, but they're also giving injections. So really, there's no oversight of these little clinics in the markets. No one's monitoring them, and no one's really checking their credentials. And they get to sort of operate however they see fit. And the community just, as one person said, like, someone puts a stethoscope around your neck and everyone believes they're a doctor. And that's how they basically function. So Nazir Shah was going to these places, and also more high functioning facilities in Larkana, trying to get his daughter diagnosed, but nobody knew to test her for HIV until Dr. Arbani came along.
Mm-hmm. And in terms of the reactions from you were saying that international agencies came in, local agencies came in to see what the situation was. Did they look into these practices in terms of how do you get more people trained? Are there efforts now since then, or are you still are they still waiting for efforts to help alleviate that situation?
I think they're still waiting for efforts. As I found out, there's also so many private medical schools in Pakistan, and they're not fully regulated. They can be certified, but they can also not be certified. And a lot of people will just pay money and go to them. And as a lot of studies have shown, they're not really being taught how to handle medical equipment properly. In addition, they just don't have it. They have syringes, so the actual syringe itself, it'll lock, but the needle tip is still exposed. In the US, if you go to any facility and you observe a nurse or doctor using a needle, you'll see them push a plastic cover on top, and then the needle's locked and you can't access it. Here, they don't have that, and it's just not available in any of the places I've gone to. Even in the really nice hospitals in Karachi, they didn't have it available.
And you were comparing that to the syringes, for example, used in the US, but I know you've traveled quite a lot in terms of your own medical practice. Tell us how what you saw in Pakistan and the conversations you had were similar or stood in contrast to what you saw when you were practicing in other countries, and perhaps give us some of those examples as well.
I think in Pakistan, I met so many people who were doctors or identified as doctors, and that's unusual compared to sub-Saharan Africa, where people identify themselves as nurses or quote unquote techs, and they were assistants. So it's more clear in Africa. I think they're training. I think there's just probably because of HIV and it's so ingrained into communities in sub-Saharan Africa, they're just really aware of being very careful with needles. I remember experience, I worked in the HIV clinic in South Africa many years ago as a medical student, and I was just starting out in the wards and I was capping a needle and probably being a little clumsy about it. And one of the South African students just stopped me and pulled me aside and really drilled into me like how important the step was. And no matter how rushed they are, no matter the circumstances, they're really careful about doing it because it's just ingrained in them. And I was shocked to see that was not the case in Ratodero.
And I know we will get to more audience questions, so please add to our Q&A there. But there is one question already in our Q&A box that I think relates to this in terms of what are were your observations in terms of when you were in these areas in northern Pakistan in terms of a denial of HIV cases versus, as you were saying, increasing as far as cultural observations that you had related to HIV itself?
Well, when I was there, the community had already been, really exposed to the idea of HIV. They already had the treatment center set up. They had done sort of the mass testing. So at that point, I think the community was quite aware of HIV and they didn't seem to be in denial at all. And, they felt really wrong and wanted people to know what had happened to them. So, there was definitely a lot of stigma from mostly like families and neighbors about the children having HIV. And there was a lot of concern about stigma and what will happen to their children when they grew up. But I think they really seemed to recognize HIV had become a problem in their community.
Mm-hmm. You said, I think in one of the cases that you were reporting on, that one particular family had one of their children who was HIV positive move in with another family. In terms
right. This family, the father was a laborer and he had already lost 2 children to HIV, and he had 2 children remaining who had HIV, and then he had a newborn daughter who was luckily HIV negative. And then his nephew actually moved in because his family, the rest of the children were all HIV negative, and they were nervous and preferred that he live with this family who already had HIV positive children.
Mm-hmm. In terms of the broader chronic problems that you witness as part of looking into this HIV outbreak among children whose parents were not HIV positive, can you talk to us more about broader chronic problems that you saw impacting Pakistan's health systems and related inequities that you saw there?
Sure. Like I said, I think for a long time, they have been reusing needles, reusing medical equipment, and that was a huge problem. There's no oversight of their education. And then their public health system is a problem. So just girl who was first diagnosed, she was considered, the sentinel case of this outbreak because that's what tipped off Dr. Arbani and just went to the news reports. But when I got to Ratodero and I met with her father, I found out he had a friend whose son had HIV and had been diagnosed a year ago. So when I went to the government hospitals and I asked them about these cases, and they showed me the charts of these children, just what they would check off, and they would check off that the transmission was unknown, meaning they don't know how the child got it, but certainly it didn't seem like they got it from the parents. In the community in the US, that would definitely tip off public health officials, doctors to investigate this. But here they were just being silently reported because they didn't have a strong public health system that really could investigate and figure out what was going on. People weren't paying attention to what was happening. So this community had a child who got HIV, not from parents, from most likely medical equipment being reused a year before this child was diagnosed. And many of these cases could have been prevented and they weren't.
Mm-hmm. And when any government or international agencies came in, then we had the overlay a year later with COVID. Have you heard anything since then in terms of what impact that had on, as we're hearing here in the US and in other places, the impact COVID had on other situations? So with HIV, was there a problem with doctors moving on and changing up and even harming that already weak system?
Yeah.
There?
So a lot of the COVID cases just aren't being diagnosed there because people aren't being tested. And then, as Anne mentioned, the doctors were being moved from the HIV treatment center to fill other spots. It could be directly to go work for COVID, as the doctor who was in charge of the HIV unit was, or other spaces just opened up because those doctors moved on and had to work on COVID. So there's a constant, turnover, and also there's times where they're just down to 1 or 2 doctors at the treatment center. So that's been a problem. Medications were a problem because if they couldn't get to the clinic to pick it up, then they weren't able to get their medications for whatever period. HIV medications, they need to take it every day. And then they also needed to be tested for their HIV viral loads, and that could be delayed, and diagnostic tests were delayed. So even though COVID itself may not have impacted this community as much, though they don't really know because they weren't being tested in other ways, was affecting all these children with HIV.
Mm-hmm. And have you, since your reporting there, have you had contact with any of your primary sources in recent months or even within the last year to see how those young children are doing, how the doctors who have been in, are trying to stop this type of transmission, how they're doing and how they're coping?
Yeah, I still message with Dr. Arbani and one of the local journalists, and there's cases are still being diagnosed, so new cases are being diagnosed, whether these were kids that weren't diagnosed earlier or they were newly infected. I know they've had quite a bit of turnover at the HIV treatment center. And again, the government HIV doctors have also turned over several times as well since I've left.
Yeah. Now, as a practicing physician as well, emergency room physician, how do you, we're transitioning a little bit, and we'll get back to actually also more of the reporting itself, but I'm interested, and perhaps others in our audience are, how do you transition from your work as an emergency physician to reporting on these issues? Can you talk a little bit about that too, that process?
Yeah, when I heard about this story in particular, it just combined everything I was really interested and passionate about. I had gone into medicine to do international work, and I had done it for a long time, and I was interested in also writing about some of these issues. And when I heard about this HIV outbreak, I just thought, of all my time spent overseas, this is so unusual that these kids had HIV and their parents didn't. It didn't seem like a lot was being done. So I think my experience working overseas and my experience as an emergency room doctor really lent itself to the story. I had also worked in Pakistan back in 2005 after they had a devastating earthquake. So it was in a totally different part of the country, but I, had a tiny bit of familiarity with the country and was comfortable returning there again. But for me, when I work in an emergency room, it's so different. My interactions with patients are so limited, they're so short. So I think this is just really, for me personally, just a nice compliment to be able to spend time with people and talk to them for hours and really hear about their stories.
And it's different than writing, if you were writing something up for a medical journal
Right.
as well, right? That's a different story on that. Has this outbreak actually been written up in are there investigations of it in a more medical peer-reviewed journals that you're aware of, or is that something we should be looking into as well? Seeing where they're
Yeah, I know the Lancet had a piece. Dr. Fatima Mir, the doctor who came from Aga Khan to help in Ratodero, she and her colleagues, conducted investigation of these children and the reuse of the needles. So it had been published, and I think British Medical Journal also had a piece about it.
Mm-hmm. And when others who maybe don't have the background that you do, but journalists who want to report on these public health issues, or other physicians, do you have suggestions on how to go about or how they should be looking out for these types of stories to then report out to a more general audience?
Yeah, I mean, I first heard about this outbreak from, news reports that were already written. So I think always looking in local newspapers and hear what's going on. And then I think always just looking for the story behind the story. I think initially, at least in the news reports, they kept blaming this one pediatrician for the outbreak. And it just seemed a little bit unlikely that this one pediatrician would be able to infect so many kids. So I think looking underneath it all. And then, again, like with this, it's easy to just say it's just reuse of needles, but it's also, there are cultural reasons that they like injections and feel if they don't get them, they don't get treated. There's poverty conditions that result in reusing of the needles and why they go to these private doctors. So I think just looking deeper than the quick story.
Mm-hmm. And I know there's always, as from the Pulitzer Centers, there's always the need to be out there in the field for longer periods of time. How did you, I know you've been a contributing writer for the New York Times Magazine. How do you go about pitching these stories? Because you're not a full-time journalist, you're not a full-time freelancer even, you're an emergency room physician. So give us some insight into that as well.
Sure. I had written a couple of stories for them already, so I was interested in writing this story because of my background. So I pitched it to them, but I also pitched it to them with the understanding that I would try to get my own funding. The New York Times Magazine has been incredibly generous with me, and I think they would have paid for the reporting, but it was my first international story. I know Pakistan could be a difficult place to work. So I wasn't sure I could definitely pull it off. And I had heard of the Pulitzer Center and their travel grants, and I thought it was an ideal fit. But I think, that's what makes the Pulitzer Center so great, because if you want to pitch a story requires travel and you hadn't worked with a newspaper before where it's been limited and you're not sure they can fund you, I mean, this is a great way to do it.
Mm-hmm. So in terms of the suggestions, though, in terms of as we were just talking about, suggestions how others might report, looking at their own expertise and their own interests and finding these stories and finding outlets or funding for it. I think you've also had the general public respond to your reporting as well in terms of what they can do in terms of helping out this individual community, helping out a broader region of Pakistan. What have you heard from general readers, and what has been your response to them?
Yeah, probably more than any story I've written. I've had so many emails and messages from people about how they can help. And that's been difficult for me to field because a lot of them, they want to donate medical equipment, which, is difficult to get it down there. And then also the syringes that we use here are very different. So people will need to be trained, and who would do the training, and what happens when the box of syringes run out, or people who want to go down there and volunteer for a couple of weeks to help. So that's been, great to see such a response from people, that people care so much about this community that's far away from almost all the people who've reached out, and in the middle of the COVID pandemic. But it's also been difficult for me to try to get them connected to people down there to see how they can help.
Mm-hmm. And is it in terms of the overlay in part because of, as you were saying, what's going on with COVID, or just that there's not a good avenue through which other maybe organizations are working there, or that the local systems are not set up to receive such donations or supplies?
Yeah, I mean, I think even just getting anything to Ratodero is so hard. I mean, the closest international flight would be to Karachi, and then it's another 6-hour drive. And I don't think the local systems are set up to handle it. These clinics and the markets, they pop up, they close down, they're not monitored that closely. So really the stuff needs to be coordinated by a government agency. And since the government is not fully doing that right now, it makes it challenging for any intervention to really work long-term. Dr. Arbani is great, but he's one person trying to help in the midst of this.
Mm-hmm. And a few other questions I see are also coming into the Q&A. So just advising our audience to send anything further. And I think some of the questions have been addressed by some of your answers. We do have a particular individual who is from the Awakening, who said that these particular clinics were closed for some time, but that he has seen that they have been reopened during COVID-19. So that's someone from the area. A question, just going back to some of your reporting in terms of your interactions also with the government officials, in terms of the conversations that you had. How difficult was it, as both a physician, but someone who was reporting on this, to some of these conversations that you might have been having with the government officials or with other doctors, bringing up your own background? How did you intersperse any of that in terms of that reporting on this issue?
Yeah, I mean, the interaction with the government officials was quite difficult. I had a hunch based on my time previously in Pakistan that I should go to Ratodero first and then talk to the officials at the end, because I thought if I did it the other way around, they would probably stop me from going, or send someone down there to accompany me. So I was glad I did it that way. I wanted to talk to the officials to see what they thought was going on, and I think they're not really used to being questioned by journalists. So I think they were upset about being asked why they didn't do more. I mean, I think there's also a culture of cover up and reputation and trying to look good. One of the lab technicians had actually quit early on because he would do these news briefings and he would be told by the government, please just downplay the number of cases. And he didn't want to lie, so he just ended up quitting. So I think it was difficult talking to the government officials because I didn't, first of all, I don't speak Sindhi, so I had a translator who was great and always translated everything. But it was hard because they wouldn't always be forthright, and they would try to tell me things that I would be like, you would think you're going crazy, because I was just at these clinics and they weren't throwing away the needles properly. And even if they wanted to, they didn't have the boxes to put them in, and they would just keep saying over and over that they're all there. So, I mean, I think was a great lesson for me that I can share, is encourage everyone to just, you have to be there, and you have to I had to go to each of the little clinics and the markets one by one and just check out what the actual situation was, because, people will tell you something different.
Mm-hmm. And that curiosity probably made it for a really great piece. So if folks have not yet read Helen's piece in the New York Times Magazine, it is up on our website, and I encourage you to read it fully. We do have also a question back to your own background in terms of how you actually got into the medical field, and a little bit more about the work that you've done abroad over the years.
Sure. I'll try to make a long story short. I was actually taking a writing class in 7th grade, and I read the story by a surgeon at Yale, Richard Seltzer, who has since passed, and he wrote about working in Honduras. And I think I just read it and I just fell in love with the piece, and I really wanted to work overseas. And I thought, well, I guess I also have to be a doctor because I don't know how else to do it. He has since passed away. In his obituary, I learned that a lot of his stories were fictionalized, but still, I think the idea sort of stuck. So I went into medicine, and I just really started to do a lot of international work. I think I first went overseas during college to Kenya, just like on one of those volunteer programs. And then I just sort of, every time I had elective time or vacation time, I would find a way to go back overseas. And then I started writing about stories that were mostly in the US because, it's difficult to write international stories. And then this was the first time, with the support of Pulitzer Center, I was able to go overseas and report.
And in terms of some of the more US-based stories, what has been the avenue through which you've written these public health stories, in terms of, again, the interest areas, or do you see any corollaries in some of the things you might have seen in the reporting?
Yeah. So I wrote about a tuberculosis outbreak in Black Belt in Alabama. And I think in many ways that story is similar to this story, where, you really should not have a tuberculosis outbreak anywhere in the US with, the public health system and the resources that we have. But there was an outbreak among a poor Black community that was also did not trust the doctors and public health officials that were coming in to test them, because it wasn't done in the most sensitive way. And because of that, the outbreak grew. So I think that was something that was very similar. And I'm just always interested in the why. I think it's really easy to just blame something superficially about why this outbreak happened, but I always want to go underneath and figure out the roots of it, and because I think that's how we can really make a difference. Another story I wrote about was about compassionate use of experimental medications. There was a little boy who had cancer, and then he got really sick because his immune system was compromised, and he was trying to get an experimental drug, and the CEO of the company wouldn't give it to him because it was going through drug trials. And he eventually got the medication through social media. And the storyline in social media was that the CEO was evil, he wasn't giving the medication. But I think it's just too simplistic to say people are good, people are bad. I knew there was a bigger reason why. So I wanted to write about that story. And in doing that, I was able to share to the public about how drug trials work, because it's very complicated. I don't know if it's always the best way, but he wasn't basically giving the medication because it would jeopardize the drug coming to market and helping many other people.
Mm-hmm. And any other stories on the horizon, or you're still waiting?
To be determined.
Determined. Okay. And I know we're weaving back in the audience questions. So, and I know while you're reporting in Pakistan focused on this HIV outbreak, there's still very much interest in terms of your personal connections, that the overlay between journalism and your practice as emergency room physician. So do you believe that your journalism work, or does your journalism work impact how you practice medicine? And we could also do the reverse, but let's try this first time. How does your journalism work impact the way you practice medicine?
I think it definitely makes me slow down and listen to people's stories, their background, their personal history a lot more. In the emergency room, everything's moving so fast, so quickly, that it's really hard to stop and talk to people. And I think because of journalism, and when I report on these stories, I realize there's so much more underneath that makes me do that in medicine now too.
And then the flip side is, how does your practice of medicine impact working as a journalist, as a reporter?
I think knowing the medical terminology obviously makes things a lot easier. I think my ears definitely perk up when things are unusual. So it just wasn't just, oh, another disease outbreak in a poor community. There was something incredibly unusual about it, which is that was happening among kids and their parents weren't infected. And then the disease outbreak in the Black Belt of Alabama would have been easy to say, oh, these people, they're poor, they don't have good healthcare. Of course they would have an outbreak, but it's actually extremely unusual to have a tuberculosis outbreak in the US like that. So I think it definitely makes me become aware when something different is going on that should be reported on.
Mhm. Just to keep your ears open and see what's unusual, right?
Exactly.
Yeah. And your reporting was not related to the transgender community in Pakistan, but there is a question in terms of whether, when you were there, if you did have any observations related to how HIV affects the transgender community in Pakistan broadly.
Yeah, I mean, I think in Larkana, the bigger city, that most of the outbreaks there have been among the transgender community or people using IV drugs. So that was something that they had known about, but people there, I think, got very focused that if you weren't transgender and you weren't IV drug use, that it wasn't going to affect you. So I think, that was a blind spot that was there.
Right. And as you were saying, Mr. Shah's daughter, they didn't even consider the fact that why should they test her for HIV, because neither of the parents were HIV positive.
Exactly.
Yeah. There's that there was, if we can say, a happy ending for his daughter. She is still alive, and she has the drugs that she needs to have her. But what in your reporting, in terms of the children who are now having to take the medication, what has been the response from their parents, from their community, of what will be their future? Talk about some of those difficult conversations that parents shared with you and their feelings.
Yeah, first I should qualify. I think, Iman Shah and her family, they have a happy ending in this context, meaning she does have medications and her father's quite educated and is able to scramble for resources, but they still have to go 6 hours to Karachi because they don't trust the local treatment center after what happened. And the other part is, she still has a detectable viral load. So usually, in the US, if your HIV is very well controlled, your viral load isn't even detectable. And she's, doing great, she's thriving, but she still has a viral load that's detectable. So she's doing incredibly well in the context of Ratodero. But for some of the other families, they're not so lucky. They don't, first of all, they don't have choices of the type of HIV medicines available. The medications are donated. A lot of them are in difficult formulas to take. They don't have refrigeration, so they don't get the syrups if they can't be preserved. So they have to take pills or powders that aren't, the easiest to swallow. And then because of nutrition issues and they don't have clean water, they have to take all of these supplements, and that's additional pills, and that's incredibly hard for some of these children and their families. And they're still, struggling. They have to go to the government-run treatment center where, as we discussed earlier, they might have shortage of tests, they might have shortage of doctors. So that's been a whole other issue that they're contending with that fortunately for Iman, she doesn't have to deal with right now. And then they're all really concerned about what's going to happen with their kids. One of the local reporters who broke the story, he had his daughter tested just because everyone was getting tested now that they found out there was this outbreak, and he was shocked when she tested positive. And he really worries about her future, about her marriage prospects, which is incredibly important in Pakistan, about when she gets older in school, if kids are going to make fun of her, avoid her. And then when she gets to the point where she's old enough to ask him questions of, how did I get this? What went wrong in my childhood that I was infected with HIV?
And these children are the ones that were initially tested, and now they're most under 10. And I recall a story we supported some years back about a teen group in a particular country who were HIV positive, and they created their own support groups as teenagers. And so it made me think, these are very young children, but as you're talking, as they get older, they'll be asking questions. Are the parents thinking, are they themselves organizing? We have a particular question, is there a local group trying to organize the parents to raise either more awareness of, a support network? The question particularly is to raise awareness of safe needle use, but then it goes into who are the doctors that they're going to. So one, is there a support group for the parents to help them ask those questions, be supportive of each other? And two, do you think there might be this type of development of the children themselves trying to come together? Or
Yeah,
do you think
been some
professionally it's a good idea? I apologize.
There's been some local groups that have been started. Dr. Urbani actually has his own foundation. He does a lot of HIV teaching. Gulbahar Sheikh, the reporter, he actually started his own, where he does a lot of HIV messaging about reducing stigma. And then I think, social media for them, like Nasir Shah shared that his daughter had HIV because he, wanted people to know what had happened, wanted people to get tested. So I think there's definitely room for the kids to share their experience with each other and the parents to support each other.
Yeah. Well, thank you so much. I mean, as it's really been a pleasure and an honor to speak with you today. And as I mentioned to our audience, I hope folks will read Dr. Helen Ouyang's reporting that was in the New York Times Magazine. And really thank you for our conversation today. And thanks to our audience as well. And I also wanted to thank my colleague at the Pulitzer Center, my colleagues, especially Kayla Edwards, our producer for this session. And we appreciate all of you for joining us today. And for those of you who are able, please support our mission with any level of contribution. And remember, we are a nonprofit journalism organization. And so we depend on donors to carry on the work and support such great reporting projects like Helen's down the road. We'd also like to share some information about some upcoming events. We have a series, start of a series tomorrow, a series of workshops for educators on elevating underreported stories of resilience in the classroom through global news and media literacy. It is open, so if you are interested, please sign up at the Pulitzer Center website. And later on in this summer, we'll be having a series of connections with AAJA, reporting, bringing journalists to those AAJA gatherings. So again, learn more and register at pulitzercenter.org. We'd appreciate if you could stay a few more minutes longer to take a brief survey after we officially close today's session. And thank you again for being with us, and we hope you'll join us soon. Goodbye for now.
Thank you.